Okay, hello, good morning. You are welcome to the second segment of this presentation on health impact assessments for mining industry. So I believe you had a very nice time listening to the first presenter and have learned a lot, because this what we are going to have now is going to be like an addition to the background that he has laid concerning assessment of health impact for mining projects. So as a way of trying to let us understand, first of all, sorry, my name is Ukemeyelo. We have to understand that health impact assessment, basically, generally, is a relatively new area when it has to do with the assessment of impact of projects on the environment and humans. So, relative to the general environmental impact assessment, this could be considered as a more or less like a younger cousin, more like second younger cousin to the environmental impact assessment. But that notwithstanding, is an area that is developing and is gaining prominence in so many countries and areas when it has to do with assessment of impact. And even in the developed world, this impact assessment methodology or method is fast gaining prominence as a way of assessing the impact of projects on humans and the environment. So the environmental impact assessment, to start with, a model is not really sufficient to reflect the health impact of a given population. You really want to look at it. That's why this topic health impact assessment is timely, so that we can broaden the aspect that has to do with the health of the project. So what we are going to look at today in this segment is going to do with the scope of the health impact assessment for mining project, as well as the challenges that the health impact assessors, the health impact assessment practitioners face in trying to assess the impact of mining projects on the health of the communities within this environment. So let's start with trying to have a background information, general background information that has to do with health impact assessment. What does it really entails? So as a way of trying to understand this concept, so first of all, we have to understand that the main objective of health impact assessment is just to has to do with applying a knowledge and evidence about the health impacts to a specific social or community context. Just that this basic knowledge has to do with comes from previous studies, maybe an epidemiology study within an area, whereby results or information will be preferred, and which this is now adopted as the basis for the assessment of the health within the environment. So, as a background on large-scale projects in the extractive industry, don't forget we are talking about mining industry here. Are often controversial and associated with long-term adverse health consequences to the local communities. So, furthermore, the health impact assessment has been institutionalized for the mitigation of the anticipated negative health effects by trying to enhance the benefit of the project, the programs and policy, in this case, the mining project within an area. So we have to understand that the mining project comes with negative impacts, and what the health impact assessment tries to is try to have come up with a mechanism or a tool in which the negative impact of this project is mitigated, and the benefits or the benefits that comes with the project are enhanced. And this could be really enhanced or carried out through adopting the health impact assessment as a tool for this. And furthermore, health impact assessment has gained great prominence as an intersectoral action tool to promote health and reduce inequality. What this means is that various sectors within the environment, and which has to do with the social environment, and have adopted this vital or important tool as a way of trying to promote the health and inequality, how to try to reduce the inequality, which has to do with making some people vulnerable as a result of projects based on the negative health impact that comes with this project. So health impact assessment tries to promote this and try to reduce this negative impact or making some people vulnerable. So furthermore, the modern health impact assessment tries to pursue a systematic evidence-based approach, usually employing quantitative and qualitative methods with broad stakeholders' involvement. So that statement has really buttressed the fact that stakeholders are really important when it has to do with health impact assessment, and this process is a systematic process, as the earlier presenter had stated. The process that are involved, it is a systematic process which has to follow from one stage to the other, and it deals with evidence-based approaches, maybe from results of previous epidemiologic studies within the area, or health informations that are domiciled within the various health centers, or for studies that have been carried out concerning the background health of the people. This is what health impact assessment uses as a way of trying to assess and come up with the level of risk that the people within an environment likely to face as a result of mining projects. So, moving on, we are now trying to look at what health impact assessment is. What exactly is this term all about? And we are going to look at the definition that has come from different angles, starting with the Gothenburg consensus paper, which was published in 1999. So it defines health impact assessment as a combination of procedures, methods, and a tool by which a policy, a program, or a project may be judged as to the potential effects on the health of a population and the distribution of this effect within this population. So unfortunately, an EIA, which is a more broader perspective of impact assessment, typically includes health effects, but on the other way, even when it has to do, it includes this health effect, it has the way of it really in a narrow sense. It doesn't really portray the whole picture of the importance of trying to carry out this assessment. So, considering the definition that we just had, it tends to buttress the fact that this process is systematic, and also it tries to look is a futuristic thing where it tries to just judge the potential effects as to what is going to before the population within that environment health-wise as a result of the distribution of the effect of a mining project within an area. So furthermore, health impact assessment encompasses the identification, prediction, and evaluation of the expected changes in the health risks. And this health risk could be either negative or positive, individual or collective, or it could be caused by, which is caused by the policy, plan, and program in this case, the mining project, as how to that affects a population. So this first of all starts with the identifying what is the particular risk health-wise that the population within the particular environment faces, and tries to predict likely impact, whether it's going to be negative or positive, of these projects on the health status of the people within the population, and after that tries to evaluate the expected changes that will come about as a result of this project on the health of the citizens or indigenous within that locality. So this is in a nutshell what health impact assessment tries to incorporate in the process of the assessment. Then furthermore, in order to minimize the negative impact, as we heard earlier, the health outcomes and maximize the health benefits. So health impact assessment is used as a decision-making tool to evaluate and quantify the potential health effects of a project, a program for the subsequent development. So it is very key that this you should understand, have it at the back of your mind. This tool, health assessment, is a decision-making tool whereby the assessment, after the assessment has been carried out, it helps the decision makers to come up with a decision as to what mitigation or what steps will be taken to address the health threats that mining projects try to give out to the members of the community where the project is being cited. So health impact assessment generally seeks to maximize the positive impact and minimize the negative impact. So moving forward, let's look at the procedures for carrying out health impact assessment. I'm just going to brush through because the previous presenter has dealt in depth or has really dissected this particular aspect of this topic. So first of all, you have to understand that health impact assessment usually is described using the following step and the procedures in which adopted to carry out the assessment. First of all, starts with a screening, which has to do with determining if an health impact assessment is warranted. First of all, you have to screen the project, the mining project itself, to see to what extent does it really portray that ability to that trait of affecting the individuals or the population that are within that community. Bearing in mind that some projects have well-designed environmental management plan or system whereby the negative impact that has to do with this mining project are well managed. So you have to screen the project first of all to understand or determine whether actually determines you carrying out a health impact assessment. Then after that, you now go ahead with the scoping, which will now help to determine which impact will be considered and for the health impact assessment. Basically, this is the broader sense of what we are trying to look at, in which we are trying to look at the scope of the health impact assessment. How far, what extent can this impact assessment be applied or be carried out in order to try to understand the vulnerable or the communities or population that are prone to be affected health-wise. So that's how to do with the scoping. And after that, then the next stage will have to do with the identification and assessment of the impact, which has to do with determining the magnitude, to what extent is it going to be high magnitude or low magnitude, and the nature of the impacts that comes with this mining project. Bear in mind that different mining projects have a different impacts, considering that considering a mining project that has to do with lead and other impacts, the negative impact or the impact that comes with the project will be different from a project that has to do with quarry activity, where most of the impacts will be from the dust and vibration from blasting activity. So having that at the back of your mind will help you try to identify the impacts before the assessment is carried out. And also you also consider the extent of this impact. To what extent, what is like in terms of the geographical area, how far is the impact going to go further, and the likelihood of the potential impact on the health of the individuals or population within that area, as well as the variety of different methods and type of information. So all this has to help you to understand the proper assessment method to be adopted in terms of assessing the health risk of a a project or a mining project. And also, another aspect that's very important when it has to do with the career and health impact assessment, has to do with the decision making and recommendation, which has to do with the making explicit trade-off as to the decision that has to be made and formulating evidence-based information, which will help in recommendation. What this means is that you have to weigh explicitly the impact that has been assessed, so that it will help you to make informed decision. And also trying to make decision, you have to work with evidence-based information, which will help you to make a recommendation. Evidence-based information, such like maybe records of health challenges within the community, by way of trying to understand the background health status of members within that community. Who are the likely vulnerable members? What is their class? Understanding the age structure within the community. All this will help you to have proper knowledge of how to come up with the proper decision as to how to handle the impact that has resulted from mining project. And lastly, also you have to carry out evaluation, monitoring, and follow-up, which has to do with a process of trying to has to do with the process and impact of evaluation of the health impact assessment, as well as monitoring and managing the health impact of the project. So after you must have carried out your evaluation, you have to come up with a proper monitoring schedule and follow-up plans as to how you have to monitor the health impact of a mining project within a locality, maybe by carrying out a structured or systematic way of collecting health information and testing this information on samples within the population, within the community, and also reviewing the various health records from various designated hospitals, which will give you an idea of if the impact or if the mitigation impact that has been put in place to manage the health conditions of this mining project within this area is really effective or not. So that is a way of following up on the impact of the mining project when it has to do with the health of the population. So moving further, let's now look at why do we actually need to carry out health impact assessment? What is the basis for this? And as a matter of fact, health practitioners maintains that due to the predative and multidisciplinary and intersectoral participatory nature of this study, it has to be focused, which are also focused on social inequalities. Health impact assessment will help in the proper decision making and also help to maximize the health gains that has been put in place. So having a proper knowledge, predicting and employing the different disciplinary assessment method from various experts into the health impact assessment will help to manage the health gains, probably by way of the mitigation measures that you've already adopted to improve the health status within the community. So health impact assessment is based on 4 values that link the health impact assessment to the policy environment. So health impact assessment is linked to the policy environment using these 4 values. And first of all, the number one value there we are going to look at has to do with democracy. What this simply means is that allowing the people to participate in the development and implementation of the policies, program, and projects, that's in this case the mining project, that may impact their life. So if the people are inculcated or consulted or involved in the process of developing this mining project within their community, they will be able to have a say and give feedback as to the major health challenges that this project might bring to their community. So that is one of the values that health impact assessment anchors on, and why we have to carry out this important assessment. The second one is equity. Equity in the sense that impact assessment tries to assess the distribution of impact from a mining project on the whole population, with particular reference to how the project will affect vulnerable people in terms of their age structure. Is it women, or is it the elderly, or is it the children that are vulnerable to this? And also the gender-wise, we consider the gender as people that are vulnerable in terms of gender, is it male or female that are more vulnerable. Also consider the ethnic background in particular, considering the projects that are decided in multi-ethnic environment, as well as the socio economic status, whereby what is the economic status of the people? Do they have the capacity to try to mitigate the impact of this project by maybe acquiring nose masks to prevent them from inhaling the dust, or having the financial capability to manage their health by maybe seeking treatment in the healthcare facility. So all this has to be understood for the sake of equity, and that is why health impact assessment is very important. Another value that you should have at the back of your mind, which should try to encourage us to carry out this important assessment, has to do with sustainable development, which starts with which involves both the long-term and short-term impact, along with the obvious and less obvious impact. So the long and short-term impact of the mining project within that area has to be considered in order to come up with appropriate mitigation measures, which will now enable this project to be carried out sustainably within that environment. So another important aspect that has to important value that tries to seeks to encourage the assessment of health within a project, a mining project, has to do with the ethical use of evidence. And this has to do with the best available quantitative and qualitative evidence must be identified and used in the assessment. This, in a nutshell, means that you have to be very thorough in the evidences or the information that you use as a background or as a way of trying to assess the health status within this community, which will not inform the assessment or the mitigation measures that you adopt, and we have to do in the environment. And what kind of evidence should be collected using the best possible method. So you should not streamline yourself to a particular method so that you now have a basis of ensuring that this evidence that you are using for assessment of the health status within this community is based the standards that is required. So another thing you have to consider also is how to do with the promoting cross-sectoral working condition. So what this means that health impact assessment tries to understand the health and well-being of people by determining a wide range of economic, social, and environmental influences. So these influences try to influence the health and well-being of people within this area. So health impact assessment try to promote this cross-sectoral knowledge as to finally come up with a proper assessment methodology. And furthermore, we have to understand that the health impact assessment is a participatory approach that helps people from multi-sectors to work together. So people from different sectors have to work together in order to ensure that the project or the mining project is sustainable within that area, and the impact on the people health-wise is not too detrimental. So another thing that has to be considered is the best available evidence, which has to be provided during decision making for decision makers. So health impact assessment seeks to provide decision makers with a set of evidence-based recommendations, like I said earlier, about the mining project. So the decision makers can then decide to accept, reject, or amend the mining project if at all it has not been established, or if it has established, try to come up with another project option as to try to minimize the negative impact that has on the health of the citizenry, the population within this area. So furthermore, the Another thing that has to be considered has to do with the improves health impact assessment, tries to improve the health and reduces inequalities. So one way of contribute to health and inequality gender is through the use of health impact assessment. So if you carry out health impact assessment, invariably you are going to have a broader or proper knowledge of the people that are vulnerable within these communities and that are prone to the health challenges or risk as a result of a mining project, whereby you may not really have this clear picture if the health studies is embedded in a broader EIA study. So that is the importance of you carrying out using it as a tool in order to assess the health impact of a mining project within the area. So it tries to ensure that the mining projects do not inadvertently damage the health and try to reinforce inequalities within this area. So another thing that health impact assessment seeks to address is it is a positive approach in the sense that health impact assessment provides decision makers with options to strengthen and extend the positive features of this mining project. So it has this positive mindset that even understand that even the mining project also has a positive benefits or impact within the community. So it has that broad mentality, broad view. It approaches the health status within the community in a positive way. So with a view to improving the health of the population. So another thing that impact assessment tries to address is important to adopt has to do with the timeliness. So this has to do with trying to influence the decision-making process. So a health impact assessment recommendation must reach decision makers. So decision makers must have this information well before any decision about a project, in this case, the mining project, is well made. So before a decision is being made, health impact assessment will try to provide decision makers with the required or needed information that will help them in deciding on the steps or the next approach that should be decided when it has to do with the health impact assessment. And also, we have to understand that the positive approach of this aspect has to be considered as well. So, what is now the scope of this health impact assessment, which is the main topic, and to what extent do we have to go in carrying out health impact assessment? And first of all, we have to understand that this is a relatively new area of impact assessment, but that notwithstanding, it helps to really dissect the health impact that comes with projects like mining activity. So the scope seeks to help to identify those that are likely to be affected by the mining activity. Also, the process may include trying to identify communities and geographical regions, the demographic, the economic, racial, and ethnic groups within the area, and also the vulnerable populations such as children, elderly people, disabled people, the low-income people, and ethnic minorities, as well as people who have pre-existing health conditions. So that word pre-existing health condition is very key in health impact assessment because it is the existing health condition that the mining impact of the mining project will be built up on. So some people may have had diseases or health conditions that, as a result of this mining project, the disease is now aggravated. So that is why you have to carry out this important assessment to actually have this background information and also understand to what extent or the scope in which you can go to properly carry out this assessment. So the process, like I said, is trying to describe the pre-existing health issues, the health disparities and influences on the health, which also tries to broaden the scope of this impact assessment. So how do we now establish the scope of our of health impact assessment? To what extent? First of all, we have to try to establish the boundaries of the health impact assessment by identifying the health effects to be evaluated. So you have to understand to what extent, what is the boundary. Maybe if there are other environmental determinants like surface water, or the area is prone to high wind, and with the direction in which the wind is traveling. So you have to understand the boundaries. How far do this impact travel before you can now, and then have to identify the health effects that comes with this mining project within the environment. So that will form a background to the scope to the health impact assessment when it has to do with mining projects. So therefore, the well laid out scope for health impact assessment saves time, saves work, and also resources in the later stages of health impact assessment. So if you having a broader knowledge of it, will save you the time and the resources of trying to mitigate or trying to solve the problems in the future when you did not really have a clear idea of to what extent this impact will travel. So another thing you have to understand as in designing the scope of trying to assess the health of impact of a mining project within the environment, it has to do with the population that is to be affected. What is the population size of the people within their environment? What is the population structure in terms of the male and female, in terms of the age? What is the percentage of the elderly? What is the percentage of the the youth? The newborn babies. What is the percentage of the pregnant women? What is the percentage of the disabled people? So we have to have this clear knowledge of the population structure or population of the affected people so that you can now design the scope of how you can assess the health part of this mining project in the environment. Also, a proper health impact assessment team has to be structured. So the knowledge of the impact and the type of impact that has to do with the kind of mining project will give you an idea of the health impact assessment team to which we can structure to help you carry out a proper assessment. So this is very important in designing the scope of the health impact assessment. And furthermore, another information that you need in trying to design the scope has to do with the source of data. Where are the sources of your data that you are going to use for the impact assessment, and what method is going to be adopted in collecting this data, and what are the alternatives to this data if you don't actually have them. Source of data such like, for instance, you have a mining project in a community, for instance, a mining project that has to be mining of hard metals, and which could lead to lead poisoning. How would you assess the data within the environment? You have to first of all understand the basic health status within that community. What are the various, what are the, how many health facilities will they have within that locality, and what is the level of equipment? How equipped are these health facilities within this area? And also, how often do they keep their records? What information do you really have that will support you or will help you as a way of trying to having reliable data to carry out the health impact assessment? So you have to carry out all these assessments as a way of trying to understand the scope of the impact assessment that you'll be carrying out for the mining project. So what the next thing the health of and assessment process for a project. What are the major health determinants? What are the key indicators that you have to look out for when you are trying to carry out health impact assessment? First of all, you have to look at the biological factors, which has to be, example, the age and the sex and the genetic composition of the individuals within this area. This will help you in trying to structure a proper health impact assessment. Also, the preconceptual and utero exposure level. For instance, in the maternal nutrition and during pregnancy, what are the level of exposure of this class of individuals within that community to the impact of these mining activities within that area? So those are the potential determinants that will give you information as to the health status of the community or the population. Also, the personal behavior and lifestyle in terms of diet, smoking, rate in the area, the rate of consumption of alcohol, how often do they exercise, and how are they willing to take risk within that community. So this key information will determine to what extent or determine the health status of the population where you are trying to carry out your health impact assessment. Another determinant has to do with the psychosocial environment. For instance, the family structure, the community network, the cultural and social exclusion. The family structure in such that what is the combination to how many, what is the rate of polygamous marriage within the family, and what extent are they associated with each other? Do they live a communal life or live such a life whereby the individuals are living in separate homes? All this has to be factored in and give you a clear indication as to the health status that's supposed to be assessed as part of the impact of the mining activity. Another information that is another determinant is the health environment. For instance, the air, the water, the housing, the transport, the noise, the waste disposal. All these are physical environment which combined with the impact of the mining project and has an impact health-wise on the population within the environment. Also, the economic in terms of the employment and education. What is the level of employment or unemployment within that environment, and to what extent do they have the adequate education to try to understand the impact of this project within the environment. Also, the public services within the environment, such as the quality and access to healthcare, education, leisure, and the rest. This will become a very major determinant as to the health impact assessment process for a mining activity. And lastly, the public policy, we have to do with the economic, the welfare, and the crime policies. How do they manage the crime rates, and how do they what are policies are put on ground as to take care of the welfare of the population within that area? Those will give you a clue to how you approach the health impact assessment. So having done with the first segment, we're now going to look at the health impact assessment, the challenges that we often face, that health practitioners face as in the process of trying to assess the health status or carrying out health impact assessment within a mining project area. And as the way of trying to understand this, you have to understand that health impact assessment represents the first stage of monitoring and surveillance of environmental, social, and health conditions of impacted communities, and setting the basis for adaptive tuning of intervention or mitigation strategy that can, in the best circumstances, elevate the local population general living standard. So health impact assessment, having that at the back of your mind, that health impact assessment is the first stage whereby we use to monitor and try to understand the impact of a project even before the environmental factors, which sometimes could take a longer duration, surface. The health conditions or the health information could surface very fast and give you a proper knowledge as to the health impact of within that community. So what are the challenges that are being faced as to carry out health impact assessment? First challenge has to be adopting a variety of models in the health impact assessment. So several models are used to measure health impact in different ways. such that they include such processes like adopting the use of checklist procedure, which uses perceived determinant of the health as a marker of changes in the health risk. So what this actually means is that some key information that serves as determinants will be assessed by using a checklist, and there are different varieties of models which kind of has conflicting way of trying to assess this method. Don't forget that this is a relatively new assessment tool compared to the environmental impact assessment. So there are still a lot of tools, a lot of models that are being developed in order to be used to assess the health impact assessment. So these are a little bit of challenge as to which of the models or one is far superior or better to proper assess the health impact within the environment. Another as to carry out health impact assessment has to do with the lack of accurate health information record. Now, this is very important or very common within the developing countries, and especially in the rural areas, whereby accurate health records are not being kept and they are not being documented, which could easily be adopted as a data for in order to have a background knowledge of the health status within the community, and also try to analyze or evaluate the health status, the predominant health condition within the communities. So the lack of health information records within the health center or hospital within the environment or within the population where these mining activities are located is a major challenge. Another information or another challenge has to do with the background disease rates. So background disease rate is such that it has to do with a range of data sources, which includes epidemiological studies, quantitative and qualitative information, which are being routinely carried out within that area. So the background disease rates, which in most cases are not available, and this will be a major input to the health impact assessment, is a major challenge and a setback as to carrying out proper health impact assessment. Also, multiple sources of contamination. For instance, maybe where you are having your mining project, there could be other projects within that environment, or there could be a result of the environmental condition within the environment. It could be a prediction or a suspicion as to contamination coming from different sources. So this kind of cause a little bit confusion and brings up a little challenge, cause some challenges when as to having a proper health impact assessment for a particular population. Another one is another challenge that we have to understand has to do with the variety of pathways. Variety of pathways means that the channel or the approach which health impact assessment is being carried out, and the difficulty with this pathway is so complex that it's not often possible to say if an outcome of a particular assessment will definitely be good or bad, or as to which population is really vulnerable, and or which source is this impact or contamination coming from. So the variety of pathways is which this process is being assessed is a major challenge. And lastly, another challenge that has to do with assessing health impact assessment has to do with the population size and the size of the exposed group. And typically in developed, less developed society, and especially in the rural areas, the accurate information on the population size are not really available. And as part of your health impact assessment, you may not really have the luxury of time and resources to actually establish the population size and structure within that community. So this may pose a little bit challenge as to you coming up with the proper health assessment method. So we've come to the end of the training. I hope you